Okay, guys, y'all get your turn here. We're going to talk about the male genitourinary system. Um, this is the chapter that I was telling you that you'll have to write down some notes, okay? Um, this is just a picture of the male reproductive anatomy in case you've forgotten. The male GU system has two functions, basically. Number one, urine elimination, and then reproduction. It's made up of, number one, the testes, which are responsible for producing the male sex hormones, mainly testosterone, and then sperm. Number two, you have the accessory organs, which includes the prostate gland, the seminal vesicles, that is seminal vesicles, and the bulbourethral glands, which produce semen fluid. Number three, the genital ducts, which include the epididymis, the vas deferens, and the ejaculatory ducts, which are responsible for storing and transporting sperm. And then number four, you have the penis, which houses the male urethra, functions in urine elimination, and then sexual function. The androgens, again, are secreted by the testes, testosterone being the main testicular hormone, and then dihydrotestosterone. The main one I want you to know about is testosterone, and we'll talk a little bit more about that on the next slide. Let's review again how the hormones get the signal to be secreted. Remember, the hypothalamus secretes gonadotropin-releasing hormone to the pituitary gland. The pituitary gland releases LH and FSH, which stimulates the testes to secrete testosterone. Okay? So let's talk a little bit more about the main actions of testosterone. They're responsible for the development of the male genitalia in the embryo. They cause the descent of the testes in the fetus. And we'll talk a little bit more about that in just a few minutes. You know that the testes do not actually, are not outside of the body in the beginning. They actually start up in the inguinal and actually have to travel down the inguinal canal into the scrotum. Testosterone is responsible for the development and maintenance of primary and secondary sex characteristics. This is specifically gonadal function, external genitalia growth and development, the change in voice in a male, and then male hair distribution and skin characteristics. It promotes protein metabolism, musculoskeletal growth, promotes the formation of sperm and the maturation of sperm. Spermatogenesis usually begins around age 13 and continues throughout a male's reproductive life, which is a little bit different than women. Men can have babies till they're 80, I guess. Okay, let's start talking about a few processes, and then we'll move through some disorders too. It is important that you know exactly how an erection works. It's actually a neurovascular process that involves the autonomic nervous system, mainly the parasympathetic nervous system, and the somatic nervous system. It also involves the vascular system and chemical mediators like nitric oxide. So basically, this is what happens, okay? And this picture here that you see is not a bug, although it looks like a bug. It's actually the cross-section of a penis there. So anyway, every time I look at it, it looks like a bug to me. That's neither here nor there. Are y'all awake? Just making sure. Don't want anybody to be falling asleep on me. Here's what happens. The parasympathetic nervous system releases nitric oxide, That nitric oxide causes the tissue of the corpus cavernosum that you can see up there in the picture to relax and allow arterial blood to fill the area at high pressures through those central arteries there, thus causing the erection. So with that, let's talk about some penile disorders here, starting with some inflammations. Balanitis is acute or chronic inflammation of the glans penis. Balanopostitis is inflammation of the glands and the prepuce. That's prepuce, which usually occurs in those males who have a condition phimosis. And phimosis is when you have a very tight foreskin in your uncircumcised males that makes cleaning difficult and allows bacteria to grow. Signs and symptoms are redness, maybe a discharge. But again, usually you see this inflammation in those men who are uncircumcised, who have a tight foreskin or phimosis, which is that problem, and they don't tend to clean and have very good hygiene. Peyronie's disease, which is what the picture here is trying to show you, is when men have progressive fiber plaques that form on the tissue that covers the corpus cavernosum. This causes a bent and painful erection and painful intercourse. Obviously, you can see that fibrous plaque there that has developed on the outer tissue. A lot of men will actually have to have surgery for this. Penile cancer, although it's fairly uncommon, I did think I needed to mention it. There's a strong correlation seen in patients with poor hygiene. Again, most of the time you're uncircumcised males who have phimosis or the tight foreskin, so they don't clean very well. It usually begins with a very small lump or a lesion. It is easy to cure if it's treated early enough. And actually, it's been linked to the HPV virus, just like the women's cervical cancer. And also here, even though it's not mentioned on your slide, I want to go ahead and add a priapism, which is priapism. This is prolonged erection lasting anywhere from 4 to 6 hours. I know everybody's heard of this because now we're in the age where everybody's taking Viagra, Cialis for erectile dysfunction, and you see it on TV all the time. They advertise their new drugs, and they tell you to seek medical attention if you experience a erection lasting 4 to 6 hours, because it is an actual medical emergency. If you think about it, after men have the erection and the blood flow has gone to that area, then it's actually cut off. So if that is prolonged for a longer period of time, just think about what we've talked about all semester when you have a decrease in blood flow to that area. You might actually have some ischemia. Might actually last long enough where you might have some necrosis, and nobody wants that. Besides being caused from drugs such as Viagra and Cialis and things like that, you see it a lot in men who use marijuana, steroids, and then excessive alcohol. Okay, this picture just shows you how the testes descend from development and how they descend down into the scrotum there. See where you can see in the picture where the actual testes begin their formation during embryonic development. And as the baby is in utero and is developing, then those testes actually descend down through the inguinal canals on each side and down into the scrotum. And that whole descent is thought to be mediated by testosterone. Now, after they descend on down into that inguinal canal is supposed to close, but if it doesn't close, then the testes can actually, in babies, the testes can actually, move back up into the canal. Or you can actually have an inguinal hernia that can develop, which is an area of an intestine that drops down through the canal that you get on the next slide there. It's very common in your premature babies for their testes not to have descended when they're born, just because they're premature and they weren't necessarily ready to be born yet. But you usually give them a couple of months for those testes to descend, and then usually they will on their own, and then everything's done. This is the picture here that you can see of that loop of intestine that has actually dropped down through the inguinal canal that did not close off after the testes descended, or the testis descended. Very common for your weightlifters and whatnot to develop hernias. And then you can have them in children too, just simply because the inguinal canal didn't close off the way it was supposed to after the testes descended. Since we're talking about testes, let's talk about some testicular disorders, and you can find all of these in your book if I'm talking too fast. Again, it's pretty common for me on my test with this type of material. It's pretty much memorization. I'll just be honest with you. It's just pretty much memorization here. Let's start at the top with the varicocele. This is when you have an abnormal dilation of the pampiniform plexus, and that is actually a network of veins that supply the testes with blood. And that area, that network of veins, is actually abnormally dilated. It usually happens on the left side, usually happens in your younger male population, anywhere from 15 to 25 years of age. Signs and symptoms include pain and tenderness to that area. And when you are assessing them, examining them, that area will usually feel like a bag of worms, because just think about it, I said it was a little network of veins. So those veins are dilated, and they might actually feel like just a little bag of worms there. So that's pretty common for a varicocele. A hydrocele is when excess fluid collects or accumulates between the layers of the tunica vaginalis. There's a good picture of that on page 910 if you want to look that up. Some babies may be born with a hydrocele. Sometimes they may develop secondarily from an infection or an injury. Most babies that are born with hydroceles, though, those will resolve spontaneously, so they don't have to have any surgery. If it seems to linger on after the age of 2, they'll usually go ahead and do surgery. Testicular torsion is when you have a twisting of the spermatic cord. And the spermatic cord is what actually suspends the testes. So just think about how painful that might be if that cord is twisted. It's the most common acute scrotal disorder in the pediatric and young adult population. I'd probably put a star by that. Severe pain, nausea, vomiting, increased heart rate. Usually the testis that is affected will be higher just because of the twisting of the cord actually raises the testis. It may be larger, and it's usually tender, again, because they have some severe pain going on. Epididymitis is inflammation of the epididymis, usually caused by sexually transmitted diseases or some other type of bacteria. Usually there will be pain and swelling, redness of the skin over the epididymis. They may actually have a fever and painful urination too. Their white count's usually elevated as well with epididymitis. Orchitis is the last inflammation that I want you to be familiar with. And let me just tell you about this. Anytime you see orc on the beginning of a word in medicine or orchitis, anything with orchid on the front, you're talking about testes. I don't know why they decided in medicine to let the male testicle be an orchid, but anyway, that's what they did. So orchitis is an infection of the testes. Most of the time, it actually develops as a secondary disorder or a complication from some other infection in the body, and usually it's like a big whole body infection like the mumps or pneumonia. And a lot of times that bug not only causes its whole body effects and its normal effects, but that actual bug go down to the testes usually 3 to 4 days after the initial infection and make them even worse. They'll actually have painful enlargement of the testes, fever. They're usually very, very sick, not only from the orchitis, but the fact that they have some other systemic problem going on. And they have to be treated very effectively because just think about the testes are responsible for testosterone and then the generation of sperm. So if you don't treat that inflammation and that infection, then they can actually be infertile later on. Testicular cancer usually arise from germ cells, and think about what germ cells are. Germ cells have the potential to contribute to a new baby. So these testicular cancer germ cells have the potential to do everything that a new body would do. They're multipotent. And when I say that, I mean that they have the potential to secrete certain substances that you would think shouldn't be secreted, like HCG, which is what we check a woman for. We check human chorionic gonadotropin levels to see if a woman's pregnant. So if you suspect that a man has testicular cancer, you check their HCG level. If it's high, then you might get suspicious. Usually the first sign of testicular cancer is a slight enlargement of the testicle with a little bit of discomfort. The problem with that is because it's only a very slight swelling and a little bit of discomfort, men don't treatment early enough, and usually they will actually lose that testicle. Okay, let's talk a little bit about the prostate. I'm trying to think here how I want to talk about this. The picture's a little bit distorted here, but this is supposed to be a normal prostate. And if you remember from your anatomy class, the male prostate surrounds the urethra, okay? And this picture, again, is a little bit distorted, but see how nice and open that area is that the urethra passes through the prostate. So what happens if a male has benign prostate hyperplasia, where the number of cells increase? Then a lot of times with prostate enlargement, they're going to have compression of that urethra, which causes them to have difficulty urinating. They usually have a weak stream, urgency, pain, maybe even some burning with urination, and maybe even some discharge. But you can see there how it might cause some problems. And I have a picture in a couple slides of a male prostate with benign prostate hyperplasia. But normally you want this area around the urethra to be open. Prostatitis, the only one I want you to know about on this slide is acute bacterial prostatitis. It's inflammation of the prostate, usually caused from a UTI that has refluxed into the prostate ducts. And these men are usually pretty sick. They have fever, chills, they're tired, they're going to the bathroom a lot, they have frequency, urgency, pain and burning with urination, sometimes some urethral discharge, cloudy urine, and you can only guess what the most common bug is that causes acute bacterial prostatitis. Everybody say it. What is it? E. coli. E. coli. Same bug that causes most of your UTIs. Back to the benign prostate hyperplasia. You can see here in this picture, now this is an actual prostate here, not to go along with my my fake prostate that came out of the book, but it shows you here how the prostate has actually increased in size, increased in number of cells. So now that the urethra, which is in the middle, is only wide enough for that paper clip to be going through the middle. So whoever this man was, he definitely probably had some urinary symptoms here. He probably had a very hard time going to the bathroom, just because, I mean, look how there's no good round area around his urethra or an area for his urethra to pass through. It's only big enough for a gym clip to be slid through there. So he definitely probably had some urinary symptoms at that point. With benign prostate hyperplasia, there are large nodular lesions that will develop around the urethral area, there around that centermost area. And, some patients have worse symptoms than others. Again, it depends on how severe compression of the urethra is. Now, let's compare this BPH with prostate cancer on the next slide. Prostate cancer is the most common male cancer in the United States. It's more common in African American men over the age of 50. The etiology is really unknown, but there are some risk factors. Age, the more a man gets, the more at risk he is for prostate cancer. Again, African American men are at greater risk. If you have a family history of prostate cancer, if you eat a diet that's high in fat or high in meat products, if you have a history of benign prostate hyperplasia, your risk goes up. Now, the difference between prostate cancer and benign prostate hyperplasia, when you talk pathophysiologically, remember I said that with BPH, the problem is around the center, around the urethra. With prostate cancer, those lesions, those cancer cells usually start on the outermost area. Okay, so something to think about there. It's usually in the peripheral areas rather than there in the center, like your BPH. People who have prostate cancer, they'll usually have surgery, maybe radiation, possibly some chemo. And then last but not least, some childhood disorders that I want you to know about. Again, just mainly some definitions to be familiar with. The first one, hypospadias. Hypospadias and epispadias are congenital disorders of the penis which causes a defect in the urethral opening. Hypospadias urethral opening is on the ventral side of the penis. This is very, very common, and they'll usually just do surgery to correct that congenital disorder. Epispadias, the opening of the urethra, is on the dorsal side. And again, it's less common. Phimosis, we've already talked about a little bit, but you do need to know exactly what that is. This is in your uncircumcised man. There's a tightening of the foreskin so that it's very hard to be retracted. The problem with this is poor hygiene and the risk for infection and inflammation. The treatment for this would be circumcision, obviously. Paraphimosis is kind of the same as phimosis. This is when the actual foreskin has been retracted, but now it's too tight and it can't come back down over the glands. Most of the time when you see this, this is in your uncircumcised man who has had a Foley catheter for a long period of time, and they actually read the foreskin, and then nobody was nice enough to pull the skin back down. The last thing is cryptorchidism, and again, you'll see there in the middle of that word, the word orchid, so you know it's some type of testicular problem. This is when the testes do not descend into the scrotum the way they're supposed to. It's called cryptorchidism. Can be one testicle, can be both. You see this very common in your premature babies. A lot of times the testis will spontaneously descend within the first couple of months of life, but if not, then they have to go up and do what they call an orchiopexy and actually replace the testis, pull the testis down into the scrotum. The boy won't be infertile or have low sperm counts. And also, if the testes don't descend, there's a greater risk for cancer. So they'll actually go in and do that procedure, and it's more common than you would think. So it's not a big deal on that. So again, if you have any questions on the male GU, feel free to email me, and I'll answer as many questions as I possibly can.